Welcome back. Now, the World Health Organization has called for urgent action to prevent the spread of monkeypox in Europe, noting that cases had tripled over the past 2 weeks. WHO Regional Director for Europe, Hans Kluge, said he is intensifying his call for governments and civil societies to scale up efforts to prevent monkeypox from establishing itself across a growing geographical area. He added that urgent and coordinated action is imperative if they are to turn a corner in the race to reverse the ongoing spread of this disease. He said WHO continues to assess the risk of monkeypox in the European region as high, given the continued threat to public health and the rapid expansion of the disease. And with additional cases being reported among women and children, they are on high alert. Now, to discuss this further, I'm joined by Dr. Swati Maheshwari, Senior Internal Medicine Expert, as well as Dr. K Gupta, Chairman and Managing Director of Felix Hospital. Thank you so much for speaking to Mirror now. Dr. Gupta, I'd like to come to you first. Cases have tripled over the last weeks in Europe. UK alone has over 1,200 cases. Now, the World Health Organization on Friday warned that an urgent action is needed to contain the spread. In Asia, the situation is not as alarming as Europe, but with increasing post-COVID tourism around the world, the risk factors are high. Should this be a matter of grave concern for Asia? And does India need to up its guard?
Thank you so much. You are absolutely correct. Already WHO have described or declared that it is an evolving health threat rather than a public health emergency. They told us that it is an evolving health threat. And first case was found on 6th of May in London. And within these 2 months only, the cases are more than 6,500 across the world. And out of them, besides this, around 200, there are suspected cases also. Even the death rate is around 1 to 3%. Even one person has died, confirmed death from this. It already happened. And we all know that the disease is transmitted through the man-to-man sex. Most patients, it is noticed, it is seen that it can be transmitted to a close contact, even children, pregnant ladies, and can give complications in them also. Therefore, not in West Africa, it was definitely in West Africa, it is endemic disease. From there, it has traveled to Europe, in now in US also, and Asian countries, definitely they are less affected, but it can be one of the most important, most deadly threat to this Asian population, especially to India also, because we have a high population of 1.35 billion. So I think we have to take care of this. We have to control spread it among Indians also.
Right. We'll definitely discuss what are the precautions that the governments can take. Before that, Dr. Swati Maheshwari, I'd like to ask you this. There are a lot of myths doing the rounds. From what I read, and correct me if I'm wrong, that monkeypox has some genetic similarities to smallpox, but it's not related to chickenpox. A lot of people just hear the word pox and they think it must be all the same. What exactly are the similarities and differences between them, and which are the vaccines that currently exist that can shield us enough?
Yeah, thank you. So actually, if you see, then monkeypox virus is similar genetically to the smallpox virus. And that's why we say even the vaccine of smallpox is effective to some extent against the monkeypox virus. And we are also using the antiviral drugs which were used earlier, approved for smallpox, like tecovirimat, which is being used against monkeypox as well. Then also the IVIG immunoglobulin, which was earlier used for smallpox, is being used for monkeypox as well. So that gives us a little room for, availability of these treatment options that we have. But considering chickenpox, the problem is that these scabs and the blisters that develop in a monkeypox patient are very similar to what it looks in chickenpox as well. And that's why the confusion arises. So if we see even in monkeypox, what happens is, along with fever, headache, malaise, pain in the muscles and swollen lymph nodes, people start with spots or rashes in their body, especially from face, and which spreads over to their arms and their legs, and also the inside of the mouth. And similarly with chickenpox as well, we see as spots, and then this breaks into blisters, and also later it heals and forms scabs, similarly like chickenpox. And that's how the confusion has come in. Also, children get infected more by chickenpox, and we are seeing monkeypox is infecting children as well. So again, a similarity which is seen. But what we need to really understand is that the human to human transmission is basically through three basic mechanisms which need to be tackled and which everybody should be careful about and should know about. And that is, first of all, if you come in touch with the clothings or the beddings or the towels of a person who's infected with monkeypox, or you come in close contact with the scabs and the blisters from a person who's suffering from the disease. And the third way is if you're prolonged exposure to cough and sneezes of such a person. That's why the government has given out these advisories that if you're exposed to monkeypox or you have a person suffering from monkeypox in the family, in that situation you need to use PPE, you need to wash your hands periodically with soap and water, or use an alcohol sanitizer for that matter. And secondly, you have to isolate these patients, because if you are in close contact with these people, then even you can breathe the virus in, which happens with the coronavirus as well. That's why the advisories are there. Secondly, the thing not to worry about is that the treatment is simple. We have to do symptomatic treatment initially, and for severe cases and for immunocompromised people, we do have antivirals which were earlier used for smallpox, and we can use it for monkeypox as well. But most of the disease, it passes off by itself, so it is a self-remitting disease. So generally isolation and giving good amount of fluids and some symptomatic treatment is very helpful, and people need to stay in touch with their healthcare professionals so that in case the need arises or there are complications or the condition is not improving, then they should take the person to the hospital, and the treatment needs to be revised.
Right. Dr. Maheshwari, just following up on this point of transmission, another pain point here is the mutating virus. We have seen multiple variants in the past for COVID, some as deadly as the Delta. But as far as monkeypox goes, could the mutating virus pose more risks like faster transmission or perhaps the virus being more lethal?
See, there's always this probability with viruses because they are very notorious in changing their shapes and their nature. And that's what we are seeing with the recent study that was published in Lancet as well, that the presenting signs and symptoms are very different in UK from what they are in Central Africa, where the disease is endemic. So UK is seeing more of these blisters and scabs earlier to fever. So they are seeing less of fever, and they are seeing less of body ache and headache. They are seeing more of these scabs and these blisters, and which is especially more in the genital and the anal area, because what they are seeing is the spread is more in people who are having sex within bisexuals, or who are having sex with the same sex. So it's in the sense men having sex with men. So that's why the blisters are more anal area and in the genital areas, and that's why it is confused with sexually transmitted diseases, HIV, and all the other various diseases that are there. And sometimes monkeypox does not pop up in your mind when you see such kind of lesions. That's why the presentation is variant in different kind of regions, and that's why we have to be very careful, because if any person is seeing such kind of blisters or scabs or anything, or they are feeling that unexplained rash is there in certain person along with fever or malaise, then definitely we should think about monkeypox. And especially right now, since with the travel which has increased in these summer vacations to the European countries, there are more chances of such people coming back to India infected, because the incubation period is quite long. It's 21 days. So if you've had an exposure 21 days prior to what you're seeing now, then 21 days is a long gap where everybody needs to be very cautious, especially if they've traveled, if they've had sex at certain places, or if they've had an exposure to certain people who might be suffering from monkeypox. If there's a risk, then they need to observe themselves for next 21 days. And in case any of these signs symptoms emerge, then they need to contact a healthcare professional. Also, it should prompt, diagnostics. It should prompt investigations from such kind of people. They should go and seek such kind of tests. PCR tests are available in India as well. And thankfully, we haven't seen any case in India yet. But definitely, the public health surveillance needs to go up. And also, we need to have an epidemic preparedness in India. And I'm sure the government is looking at that. And that's how the advisory also came in.
So the important point here is that the incubation period is 21 days, and if Europe is currently seeing a surge, which means the next 1 month is crucial for the rest of the world as well. Dr. Gupta, I'd like to get you in here. We spoke about how this could perhaps is a sexually transmitted disease, but who are the most vulnerable to this disease, and what happens to the people who are already infected? And if anyone comes in contact with them, what happens to them, how vulnerable they are, and also what are the precautions that one can take in such circumstance?
Good, great question. First, I would like to correct one thing, that incubation period ranges from 5 days to 21 days, minimum 5 days. Means symptoms can appear as early as after 5 days of the exposure to a infected person. And after like 21 days, the minimum 5 to 21 days, they can appear in between any day. And the symptoms are normally fever, swollen glands, rashes, blisters, and crusting. And it can persist 2 to 4 weeks. In natural history, normally it disappears within 4 weeks of exposure, and patient becomes ineffective. If we talk about the complications or the more vulnerable persons, definitely children, immunocompromised patients, pregnant ladies, they are at high risk. These children can develop septicemia, encephalopathy, they can even develop blindness, severe eye infection can be there, even pneumonitis can be there, ARDS can be there, even in pregnant ladies there can be abortion or premature delivery can happen, even death of the neonate can happen. So these are the major complications. In immunocompromised patient, we definitely not, because their immunity is on lower side, they can get infected early. Even if there is infection, definitely disease severity will be high in these cases. In complication like multi-organ dysfunction, ARDS, pneumonia, encephalitis, acute renal failure, these are all high in these immunocompromised patients, and definitely death rate is high. And normal death rate is around 1 to 3%, but it can be quite severe in these three categories: children, pregnant ladies, and immunocompromised patients. If we talk about the precaution, definite precaution is please avoid travel to the endemic country. And if you are traveling, take all the precautions. Do not have sex at unknown place. And if you are having any patient who is suffering from these symptoms, please avoid, and please follow all behaviors that can avoid from contacting such infection from such patients. Like you should all follow all the universal precautions. We saw like hand hygiene, masking, because we know this infection can be transmitted through droplet infections also, skin to skin contact also, and through sex. So these all three precautions we should take to avoid the infection. Even we all know that the smallpox vaccine, it has been found in 1988 in a study that it can be around 85% protective. It can give protection to up to 85%. So those and countries where it is endemic or where now it is spreading very fast, I think close contact should be given vaccine as early as possible. We have already eradicated in smallpox in India. Definitely we don't have right now vaccine, but at least government should be prepared to deal any emergency such.
Correct, Dr. Gupta. So the takeaways here is that if you are traveling to the endemic countries, specifically the Europe or the US for that matter, to such continents, then you need to up your guard, because currently there have been no cases identified in India, but that does not reduce the risk of monkeypox in Asia. So definitely take all the precautions as discussed by the experts there. Thank you so much, Dr. Maheshwari and Dr. Gupta, for sparing your time and sharing your thoughts on this very crucial topic. Thank you. Well, that's